So microneedling is a treatment type where we are inducing using a electric pen, that induces a controlled wound injury that then stimulates the a wound healing cascade, releasing growth factors, ultimately leading to the production of new collagen and elastin. And so the history behind microneedling actually dates back probably into the 60s and 70s, when we initially had our plastic surgery and dermatology colleagues use different kind of rollers and stamping devices for treatment of wrinkles and skin laxity at that time. And of course, since then, it's evolved. The instruments that we use in clinical settings are ones that are handheld. They consist at the end of a single-use disposable tip. And in that tip, there can be anywhere from 12 to 36 needles. The penetration of those needles ranges from 0.5 millimeters all the way to 3 millimeters, depending on which device someone is using or a clinician is using available in the commercial market. And there's also different speeds that can be adjusted, and differs as a specification of that device, depending on which device is used. But so far with microneedling, given the literature that we have to date, it has been shown to be able to safely and effectively treat scars. There's striae or stretch marks. It can treat wrinkles. It can treat enlarged pores, and it can also help to facilitate transdermal drug delivery. Prior to the treatment, it's important to, of course, cleanse the skin with an antimicrobial agent. And then afterwards, before microneedling, we apply topical anesthetic. So in my practice, and I believe with Dr. Ulster's practice as well, who is co-chairing the session at AAD with myself, we use topical 30% lidocaine for that anesthetic component, and we apply it and leave it on the skin for anywhere from 30 to 60 minutes, depending on the tolerability or the tolerance threshold of the patient, depending on the area that we're treating, depending on how extensive or the entity that we're using microneedling for. So for the patient, they might feel that kind of vibratory sensation because of the electric nature of the device. But in general, it's fairly well tolerated, especially if we give it adequate time for that topical anesthetic to kick in before the treatment. Currently, we have options such as dermal filler injections. We have laser resurfacing. We have chemical peels. So microneedling is one strategy in which we can help and offer to our patients for management of these very common things. And the thing is that when we're looking at treatments traditionally and historically, like lasers, because lasers deliver thermal or heat energy into the skin, there's always the risk, especially in more richly pigmented individuals, it can activate melanocytes. It can then trigger post-procedure, post-inflammatory dyspigmentation that is unwanted, and stressful for the patient and for the clinician. So it was important to look at the fact that microneedling can be performed across the skin spectrum, because we know that microneedling is more of a mechanical action across the skin when we're penetrating those needles and creating the microchannels into the skin, but it's not a treatment that delivers heat. And so we want to be able to show that in our research, that indeed what we postulated and what in theory it makes sense, we want to be able to demonstrate that actually in the patients that were treated. And so from that, we have been, like Dr. Ulster herself, she's been doing a lot of microneedling, but I have now as well. It's a great tool that we can use. It can be used in combination with other therapies, but often if we were concerned about skin of color and the risk of potential side effects after a procedure with a different modality, now we have an option where that possibility could be quite minimized. I mean, like all things in medicine, I think it really depends, right? So there's going to be different patient characteristics, patient preferences. Cost is going to be a factor for patients. And at the end of the day, having an additional option that we know we can use in any skin types is going to be a conversation with our patients as to what they would choose and what they are comfortable choosing. So, there are now lasers, for instance, of picosecond realm that can be quite safe also for skin of color patients. But lasers may not be something that might be amenable, for instance, to their budget. So when you have microneedling, and it's being coined as like the poor man's laser due to the relative lower costs with multiple treatment sessions, it can be a great or an excellent choice for that patient. Again, they have to be, we have to set patient expectations. They have to understand that there's multiple treatments involved. Sure, there's not a ton of downtime, but there's still going to be some post procedure care they need to be mindful of and follow through the instructions of a physician. So any clinical decision is going to take into a number of all these different individual patient factors. But certainly microneedling is a very strong option amongst the toolbox in the toolbox that we have for our patients now. I think microneedling for sure is going to be quite substantially less expensive than a laser treatment. And laser treatments for treating scars and striae often also require a series. So then you're looking at a single treatment cost in multiples for both options. But yes, it would be somewhere ballpark between the range of anywhere from probably 30 to 50% less expensive. It really depends on what the clinician charges in that practice. There's some regional differences. If you're in Western US versus if you're in the coastal regions, if you're in major metropolitan cities in Canada versus some a location that's more rural, there's going to be differences in that as well. But yeah, but generally we're looking at a more or less a fraction of the price of some of the more technologies that are that are involving lasers and other options.